Muscle injuries are really common in sports and exercise. They could be the quadriceps muscle, they could be the hamstring muscles, calf muscles, could be the muscles of your upper body as well. And it doesn't matter if it's just that you like to lift weights, or it's playing football or soccer or basketball or all sorts of other sports and exercise. These are really common injuries. I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. In this Ask Dr. Geier video, I want to talk about muscle injuries. We're going to talk about a really common one that occurs especially in sports and what the possible treatment options are. Okay, Paul asks, my physical therapist says I have a partially torn rectus femoris quad muscle. This was 4 weeks ago. I'm now pretty strong and can jog lightly, but the muscle does look deformed somewhat. No real pain, but I want to be able to run and play soccer for many years. I'm in my 40s. The physical therapist recommends strengthening further with no surgery. Can you help me understand when surgery is generally called for in these cases? Okay, that's a terrific question, and it's one that I think we get a lot with hamstring injuries and quadriceps injuries generally. In case you're not familiar with the quadriceps, this is the big muscle group on the front of the thigh. It helps to basically straighten the knee or extend the knee. The rectus femoris is also involved in flexing the hip. Now, what helps to determine the treatment is what type of injury it is. If it's an injury of the muscle belly, meaning in the middle of the thigh where it's all muscle fibers, generally that doesn't need surgery because that often does very well without surgery. Plus, muscle tissue is really bad at actually holding stitches or sutures, and so even if you wanted to go in surgically, that doesn't typically do that much. The only times I've really heard of surgery for a muscle belly tear of the quads, and this is probably true with the hamstring, is when you completely transect a muscle belly. Even then, a lot of times it tends to be elite athletes. But in theory, I've heard of surgeons doing it for that purpose. Where we do typically do surgery for quadriceps injuries, rectus femoris injuries, is where basically the muscle is attached to bone through a tendon. And you can actually pull the rectus femoris tendon off of the bone in the hip, and it retracts down the thigh. And that, a lot of times, one, doesn't typically heal very well, especially if it's retracted a good distance, 3-4 centimeters off the bone. Then as orthopedic surgeons, we'll go in, open it up, put stitches in the tendon and reattach that tendon to the bone, usually with what we call suture anchors that anchor that tendon down to bone. And if the quadriceps basically tears at the quad tendon attachment to the kneecap, that's another one we would fix surgically. But muscle belly injuries or even muscle tendon junction injuries up higher up at the thigh or lower down just above the knee, muscle tendon junction injuries very frequently don't need surgery either. Things like physical therapy, which I think is really important for muscle injuries, can be helpful. There's a number of other non-operative treatments. It's not a quick treatment. A lot of times it does, like he asks, it takes time to get the muscle strength back and ultimately the function to get back to sports and exercise. But generally people do very well getting back to what they want to do with a rectus femoris or quadriceps muscle injury. Okay, I'd love to hear what you think. Have you suffered a quadriceps injury, rectus femoris injury? I'd love to hear how your doctor treated it. What did you do to get over it? So below this video, share your experience. I would love to read it, and I know other people going through the same problem would love to read it too. And if you know somebody dealing with a quad injury or rectus femoris injury, share this video with him or with her so that it can help them better understand their injury and hopefully have a better idea of maybe what decision they want to make about treating that injury. Now, if you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, I record a couple of these videos every single week, and I'd love to deliver those directly to you. So subscribe to my YouTube channel and you'll be able to see those anytime you want and have them delivered directly to you. Last, go to my website, drdavidgeier.com. There's so many resources that I create on ways to stay healthy and perform your best that I'll send to you absolutely free. Just enter your name and your email list, or name and email I should say, and I'd love to connect with you that way as well. Thank you for watching. I hope this was helpful if you've had a quad tendon or quad muscle injury or know somebody that does. And I look forward to connecting with you in one of these Ask Dr. Geier videos right here next time.